This video marks our last entry into our anti-epileptic trilogy. In the previous sketch, we were introduced to some narrow-acting anti-epileptic drugs at the Carpe Drive-In, including carbamazepine and phenytoin. Although useful in some cases of generalized tonic-clonic seizures, these agents were not useful and even exacerbated other generalized seizure disorders, including juvenile myoclonic epilepsy. However, in our first video, during Francis Pizarro's conquest of the Incas, we encountered the broad-spectrum anti-epileptic drugs. These agents were useful in focal as well as many different types of generalized seizures, including absence seizures, which means we'll see some returning favorites today. I do want to mention that this is one of those medical words that you will hear pronounced in different ways. I initially learned it as absence seizures, but people also say absence seizures. It's the same thing. So first, let's head to the classroom and learn about one last anti-epileptic drug useful in treating absence seizures. In fact, it has a very narrow spectrum of anti-epileptic action because it's only good for absence seizures. Ethosuximide. Alright, pay attention to the front of the classroom as the teacher takes roll. See that absences clipboard? That's absences for absence seizures. And if you look around the room, I bet you can spot young Braden here in the middle of one of these seizures now. Absence seizures are a type of generalized seizure that occurs mostly in children, hence the elementary setting of this sketch. They are characterized by sudden, momentary lapses in awareness, an absence attack that can be accompanied by staring, rhythmic blinking, and even small clonic jerks of the upper limbs. Teachers may notice this behavior when a student frequently becomes inattentive and stares into space, almost as if daydreaming. Following the attack, behavior and awareness return to normal, but the patient usually has no recollection that the seizure occurred. Most last about 10 seconds, and they can occur hundreds of times a day. While you're working up his seizure disorder, you'll likely run into another clue. Here's a little hint. It will be visible on an electroencephalogram or EEG. The tracing will reveal generalized 3 Hz spike wave complexes superimposed on normal background activity. Just imagine this kid in the corner of shame here. Instead of that dunce cap, imagine he's wearing an EEG cap. And let the sign announcing the 3 strikes rule remind you of the 3 Hz spike wave complex specifically. Alright, let's take a look at the lesson plan for today. Oh my. Philosophy? No wonder Braden has taken this moment to space out. Let the Latin phrases on the chalkboard, as well as the specific mode of persuasion ethos, remind you of ethosuximide, the first-line treatment for absence seizures. Ethosuximide works by blocking T-type calcium channels in thalamic neurons. This action halts the sustained rhythmical burst discharges occurring in that region and prevents the occurrence of absence attacks. Blocked calcium channels will be represented on Braden's desk by the closed bottle of Calci-Yum chocolate milk. The T-type channels specifically will be represented by the letter T on Braden's thermos. And to top it off, thermos even kind of sounds like thalamus. If you look over at the far side of the classroom, out of the teacher's line of sight, you'll see a violent representation of the most common dose-related adverse effect, gastric distress, such as pain, nausea, and vomiting caused by this bully.
Stop hitting yourself! Stop hitting yourself! Why do you stop hitting yourself?
Another dose-related side effect of ethosuximide therapy is lethargy or fatigue, as depicted by this young man who just can't be persuaded to stay awake for such an enthralling lecture. Okay, maybe Braden is just daydreaming. What is he looking at out there? Oh! How curious. It looks like the local farm festival is going on. Well, I hope they brought the petting zoo like last year. Do you think they did? The festival banner should remind you of the broad-spectrum anti-epileptic agent valproate. It turns out that valproate is very effective in the management of absence seizures too. Recall from our lesson on the history of the Incas that valproate is effective against focal and many types of generalized seizures, including generalized tonic-clonic. On the exam, when a patient presents with an obvious history of absence seizures, make sure you pay attention to the entire medical history. They may describe an occasional tonic-clonic seizure too. If that's the case, then valproate is your go-to drug, rather than ethosuximide, which is useful just for treating absence seizures only.
Oh, look, they did! They brought the petting zoo! Oh, did they bring the llamas, though? Oh, tell me they brought the llamas! Oh,
Oh, darn this interminable ethics class! Persuasion is effected through the speech itself when we have proved a truth or an apparent truth by means of the persuasive argument suitable to the case in question. Okay, can I go touch a llama now? What if they run out of llama pellets? A llama, of course, is our recurring sketchy symbol for lamotrigine, another broad-spectrum anti-epileptic medication that is also effective against absence seizures. Although it's not quite as effective as valproate, it's more cuddly, and it spits. Well, that about wraps up this sketch. Look, will you just create a distraction for me? Oh, I'm gonna see some llamas. Llama.